I'm Dr. Jay Calvert. I'm a plastic surgeon in Beverly Hills. I am a board-certified plastic surgeon, and I perform all types of plastic surgery, but I really focus on a very small set of procedures now in my practice. I mostly do everything from rhinoplasty to facelifts to complex breast surgery, including everything from breast lifts to breast augmentation, combinations of augmentation and breast lifting, fat grafting. So I'm a very versatile plastic surgeon when it comes to aesthetic surgery. I've been in practice in Beverly Hills now since 2005, but I first came to California in 2001 when I completed my residency training at the University of Pittsburgh. I spent 7 years there after Cornell Medical School, and then been here. The rest is history. The Allergan implants, which are in question, are the textured version of the implants, which means that these are breast implants that have a rough surface. The texturing initially was introduced to try to prevent what's called capsular contracture, where the scar tissue that normally forms around a breast implant becomes very firm. So it was thought that by texturing that there would be a bit of a roughing up of that capsule and they would not encapsulate. It turns out that they still encapsulate, but people like textured versus smooth implants. Interestingly, I've never really used textured implants, but for a few cases for very specific reasons, and I've always felt that the smooth implants were, in my hands, better for my patients. The texturing has turned out to be associated with a very rare cancer in patients who have textured implants. It's a pretty straightforward diagnosis because there's usually swelling, pain, and visible changes on mammograms, MRIs, and the cancer is very treatable with a capsulectomy where you remove the scar tissue. It's not benign. It is a real type of lymphoma, and this has caused Allergan to recall and to stop really placing any of the textured implants.
Allergan is recalling textured implants.
The other companies have textured implants too, Mentor and some other companies, but their implants aren't associated with the incidence of this cancer that we're seeing with the Allergan implants. It's really only been the textured implants that have been the problem. The smooth implants do not have any association with this very specific type of cancer. We are seeing that with all the publicity and the FDA being involved, that worldwide textured implants have really completely fallen out of favor. Chelsea came to me with the textured implants in place, and I think like anybody, if you have them in, you want to do something about it. Now, the FDA's recommendation is to watch and not to, sort of say, oh, everybody get these out. But I know if it was me, I would want them out. I wouldn't be able to sit with that. It's like, well, do I have this? Even though it's very rare, the incidence is extremely low. It still happens to somebody. It's not zero. So I don't blame people for saying, you know what, I want to get these out, and there are options. So the options are to, remove them, leave them out. Remove them, put in smooth implants. Remove them, leave them out, put in, do fat grafting, which in Chelsea's case, that's what we'll be doing. We'll be doing fat grafting and then removal with the capsulectomy of the textured implants. I know there's a lot of concern, obviously, about doing fat grafting with the explantation because of blood supply to the breast, but you're not really interfering with the blood supply to the breast parenchyma, the breast tissue. All you're doing is simply taking out the scar tissue around the implant, and that should not be anything that's really keeping any part of the breast alive. Fat transfer is very safe in any kind of breast surgery as long as you don't push the limits of the volume you can place. The biggest issue that I see where people get in trouble is they try to do too much in one setting, they try to go too big, and this can hurt the blood supply to the nipple areolar complex, which is what you're worried about. I've seen it. I've seen nipple death, and I've seen big problems that have occurred, especially when people just go way too far with the volume of fat they place. In the original descriptions of lipo-augmentation that were really written by the Brazilians, a guy named Luis Toledo, he really stressed going for smaller volumes and multiple procedures. 300 cc's, 200 cc's at a time. So people, when you see these, fat transfers to the butt, where people are doing 1,000 cc's to each butt cheek, it's deadly. Literally, it is deadly. And so to consider doing large volumes to the breast is not smart. So 350 cc's, 400 cc's of fat transfer to each breast, fine. I've done that. It's been very safe. I've done a little more, but if it needs to be more than that, then I say, well, we need to do an implant plus the fat, because in general, about 75% of the fat will survive, maybe 50% if things aren't good, and maybe more if it's, just a real blessing of a transfer. We don't know that, and that's why it's always the discussion. Maybe you'll need 2 procedures. Maybe you'll need 3 procedures. Maybe you only need 1 and you'll be happy. But we don't have a complete handle on why certain patients have more survivability of their fat and why others have problems. Obviously, there are complications like an infection, a seroma, a bad hematoma. Then you can lose fat to sort of the cleanup process the body has to go through to take care of that, which is why we try to minimize bruising. We try to minimize any kind of problems. And again, when you go for bigger procedures, you have bigger problems. Interestingly, when we started doing fat transfer for the breast, plastic surgeons were really terrified of doing it, because they said, it's going to confuse the mammographers and nobody will ever be able to tell, who has breast cancer. Well, nobody asked the mammographers, but once they did, they said, we can tell a breast cancer like you can see, a rat in a restaurant. It is so obvious to them on a mammogram that the fat transfer doesn't look anything like cancer. So really, you can still tell your breast cancer is there. Though they might say, there's a lot of scarring, density, or whatever, but breast cancer is a really specific look, and the mammographers are not confused by fat transfers, which is great. If they do have any problems, they have other modalities now that we use very frequently to tell if there's breast cancer. We use MRI, we use ultrasound, and then of course traditional mammograms are still the gold standard. In general, when I do an explantation with a total capsulectomy, then I do prefer that we use drains. I think it depends on when the drains stop draining, how long they'll be in. In general, it's usually 3 or 4 days.
How long is the overall recovery time for my surgery?
Recovery time for this operation is in phases. The acute recovery from the actual operation is maybe 5 to 7 days at the most. The drains will be out, the bandages will start to come off, but the total sort of down from exercise and healing of the incisions is more like 6 weeks. And really, we won't know the final result until maybe 3 to 6 months after surgery. Swelling has to go down, some settling occurs, and whatever fat's going to survive will sort of declare itself by the 6th to 8th month maybe. After 1 year, obviously, all of healing is complete. Okay. In general, I get people back to some very basic exercise after about 2 weeks. I have you do things like tricep kickbacks and some curls, maybe do some squats and lunges, but I don't want you to do any running. I don't want you to do any pounding sort of exercise until about 6 weeks after. It's possible to do plenty of different exercises that will keep you in shape and get you, moving again. But the running and the pounding style exercises I don't like for about 6 weeks or so. Pilates you can get back to pretty quickly as long as you're just doing stretching and not any big impact types of exercises. In general, Pilates is really safe after 2 to 3 weeks.
Okay. How long do I have to wait to do photo shoots and look pretty?
In general, with your photo shoots, you're probably going to be ready after about 3 weeks. Even though things may be a little more swollen, that's not unmanageable. Again, with different garments and different approaches to the clothing you're wearing, you should be fine after about 3 weeks. There can be some bruising that might be residual that maybe could stop you for 4 to 6 weeks after surgery, but in general, people heal up pretty quickly from this, and it really goes quite smoothly in terms of return to work.
So my original surgery, we did the incision under my breasts. Are you going to keep that scar, or are you going to use a different area?
Same incision. We'll use the same approach. I'll be able to do the capsulectomy through that incision. without any difficulty. And the fat grafting we can do through, I may use some extra little tiny incisions, but those will heal up like they'll look maybe like a mole or something after they heal up completely. They'll be really unnoticeable. And in general, I make those little tiny pokes in either the areola or on the side of the breast, or I'll use that same incision to get all the fat into the breast. It's pretty straightforward in terms of approach, but how you layer the fat through the breast parenchyma is really what's important in terms of long-term survivability. You don't want clumping, you don't want big pockets of fat. You want it to really be evenly distributed through the tissue.
Okay, that makes sense. So I won't have to expect any bigger scars than I already have, right?
No, the scar will be the same one. That's
Okay.
the only one. We're not going to be making any areolar incisions or anything else. It'll just be the inframammary incision to do the explantation of the implant, the capsulectomy, and probably a fair amount of the fat grafting.
Okay. I was told that explants, they have to have a bigger incision. I wasn't sure why, so I guess that was incorrect and that was a myth.
Well, I don't recall exactly how big your incision is, but in general, if it's 4 centimeters, then that's plenty.
I think it's around.
That's usually what it is to get them in.
Yeah.
So in terms of getting them out, it should be fine.
Okay. And I won't have that big scar on the bottom that goes from the nipple down like I've seen.
No.
Is it maybe a lift that happens?
That's for mastopexy. If you're doing what's called a wise pattern mastopexy or anchor scar mastopexy, which you don't need.
Okay.
We've already decided that your nipple areolar complex is in the right place, so we're going to use that one incision to do all the work for in terms of the capsulectomy. Again, maybe some small incisions to do the fat grafting, but they're really small and they don't leave scars that are really perceptible.
Okay, that helps a lot. And then, do I need to drink any more milkshakes before this surgery?
I think you have enough fat as it is.
Okay.
If you want to make some more, that's okay. A little bit of bulking up before surgery is not a bad idea, but it's not necessary. I think in general, I'm going to probably I will probably be looking to replace the same volume of the implant with fat. So it just depends. I mean, we can discuss that too if you want to be a little bigger, a little smaller, or just kind of do what's best, in terms of what's possible. Those are sort of the options. And again, we want to make something that is really beautiful for you and will last.
Yeah, if they can be just as big, I mean, I'm not going to be upset if you can get more fat and make them a little bigger. So
usually people are okay with that.
I'm okay with that. Yeah.
Yeah, if we could take fat donations, it would be amazing.
That would be awesome.
They would be totally into it. We'd have lots of donors and lots of acceptors.
Right. Exactly.
But it doesn't work that way, unfortunately.
Right.
You have to use your own fat. There is allograft fat that's available now, but again, that stuff in general isn't going to survive. So it's very important to use your own fat and to make it look great.
I'm really excited. I'm really looking forward. Yeah.
It's going to go very well.
Yeah. Thank you so much for everything. I really appreciate everything you're doing.
Sure. No, my pleasure.
You've had your other procedures, any issues as far as anesthesia, how you felt during, middle, or after?
No.
Good.
No issues.
Good. Well, it's straightforward. All the stuff that we use every day is very powerful, reliable, short-acting. So we just layer it in, get you in a comfortable place. And since I hear that we're not going to have to do a lot of position change, that makes it a lot easier too. Because sometimes we'll start one way and then need to position change the other way. And that adds up over a long time.
First thing we're going to do is we put in what's called tumescent fluid, basically to get the fat prepared to be suctioned. So the way that this works is we put in saline that contains a little bit of adrenaline and some lidocaine, so there's pain control after surgery, but also the adrenaline squeezes the blood vessels so we don't get a lot of bruising or bleeding and a lot of blood in our lipoaspirate, and it gets us a higher quality fat harvest. So we're going to do that right now. And the first thing I'll do when I scrub in is finish to messing everything else. So while that's working, we can be sucking. So we need some fat. We're gonna make some breasts here. We're gonna need some materials. So for real, let's prep and drape, and then I'll infiltrate the rest of the areas. Okay. And then we'll suck the fat.
Sweet.
You have to be nice to the fat.
Right.
If you are not nice to the fat, it will not be nice to you. Like all this stuff that we're doing, like a lot of people would have had the fat out by now.
Okay.
And it'd be like a bloody mess. For reals? Can you agree?
A bunch of tumescent too?
Yeah, I mean, just they don't wait. They don't give it the time to. You know, that's how fat grafting works. You have to. There's a process to it. And Chelsea's been working for us because she's been having the milkshakes and eating, you know,
She's feeding the fat.
croissants and bread, and she's trying to go for the carbolicious diet, which is helpful.
Feed the fat.
But you know, if she loses weight and gets skinny, you know, the fat in the breasts are going to certainly do the same thing.
Right. Like 75.
So what I do is I'm going to fat graft the upper pole first, and then we'll do the capsulectomy and take out the implant, and then go from there. But we're not going to inject it with these. We're just going to use this to like try to break it up a little bit and disaggregate the fat.
Make it nice and smooth.
Yeah, so it injects very easily. You know, you can see there's a lot of like grit to it, so you have to work it.
Flip it and reverse it.
It's worth it, but it ain't quite yet.
Hang down, flip it and reverse it. It's your primitive is when yet. It's your primitive is when yet. If you got a big,
You know, and this will inject really nicely. So cannula here. Yeah, so I like this cannula here. I don't know if you can see that, but it's got a protected back end, and then the fat will come out through here. So this protects the skin, and it lays the fat in really nice in a very. I mean, this is really small. So this is going to inject, you know, like little 1 millimeter rolls of fat.
There's the pizza gauge over there.
Just enjoy yourself. Alright, so I got as much of the capsule dissected as I could from the front, but I think we're going to take the implant out now, and then we'll get the rest of the capsule out. But this is the implant. As you can see, let me bring it over to you. It's textured, but it's intact. There's no leaks, and it looks pretty normal, so I think that's good news. So Jose, you want to keep that over there?
Big time.
Now I'm going to take the rest of the capsule. The capsule's really soft, and it's not calcified, so that's a really good sign. It's really benign looking. There you go. That's the capsule. So that's out. I'll just take a look, see if there's any straggler pieces, because it was really thin. I mean, that's good. I want to not have any left, obviously. I got the entire posterior capsule, which is really good. All right, we just finished Chelsea's operation, and it went really well. We were able to suction out over 1,000 cc's of lipoaspirate, which gave us a lot of fat, and when we got it all down to the usable stuff, we wound up putting in about 180 cc's on each breast. The implants looked okay, they were fine. The left implant was encapsulated. This means that the scar tissue around the implant had gotten tight, and it actually had folded the implant on itself. We did a full capsulectomy on both sides. The right side was much easier, obviously, because there was no contracture, so the capsule was very thin, easy to remove, and we were able to get the implants out intact, capsules out essentially intact, all the capsules out, and we were able to fat graft the breasts so that they look like really nice looking normal breasts. They're not the same as having implants. Implants have projection, they create different kind of volume, so her breasts will look different, but they're still going to look very natural and very beautiful. I'm very happy with the way that this went. I think she's going to be thrilled, and those Allergan textured implants are gone. So this type of an operation, patients heal pretty quickly, even though it seems like a lot of surgery and there was a lot of parts and a lot of time. But in 3 or 4 days, she'll actually feel pretty good. She'll be swollen. The liposuctioned areas tend to, with all the tumescent fluid that we put in, they tend to swell. The swelling tends to travel down the body. And over the next week or so, she'll get better and better. But after 2 weeks, she'll get back into the gym. After 4 to 6 weeks, she'll be doing totally normal exercises, and it'll take a good 3 to 4 months before we really know the result.
Thank you for watching this video. So it's 5 days after my surgery, and I'm not on any pain meds at all. I didn't even take Tylenol today. I am sore, but to be expected 5 days after surgery. But I'm really happy about my cleavage. I can't believe my cleavage actually looks better now than it did with implants. So I'm excited to see what the full result will look like hopefully soon. I'll be able to show you.